Hi, my name is Amber Terhune. I'm the health educator for the Johnson County Health Department. This presentation is called Teens, Pregnancy, and Birth Control. Overall, the teen birth rate is declining in the United States, and this is possibly due to more teens abstaining from sex and more using birth control. However, the United States teen birth rate is still higher than other Western industrialized nations. In 2015, the statistics for 15 to 19-year-olds include there were 229,715 babies born, which is an 8% drop from 2014. 16.7% of the babies born were repeat births. About 43% of this age group had ever had sex, and 86% of them used birth control the last time they had sex. However, less than 5% of them used the most effective type of birth control. There are many disparities among teenagers and pregnancy. As you can see in the graph on the right, the birth rate for females aged 15 to 19 is higher for Hispanics, non-Hispanic blacks, and American Indian or Alaska Natives. Socioeconomic conditions can also put teens at a risk for pregnancy, including lower education, those in lower income houses, and those in the welfare systems. Teenagers in foster care are more than twice as likely to become pregnant. They also may have less access to health care, as they may be unable to seek it or afford it. There's also a higher incidence of infant health problems, such as low birth weight, prematurity, long-term health issues, and especially for repeat births, as they should be spaced at least 2 years apart. There are many burdens of teenage pregnancy on teen parents, their children, and society. In 2010, the financial burden of teenage pregnancy and childbirth was at least $9.4 billion in U.S. taxpayer cost. This money was spent on increased health care, foster care, increased incarceration rates among some children of teenage parents, and lost tax revenue due to lower educational attainment and income for teenage mothers. Teenage pregnancy also leads to higher school dropout rates. Only about 50% of teen mothers receive their high school diploma by age 22, compared to about 90% of women who weren't teenage mothers. Children of teenage moms are also more likely to drop out of school. Overall, statistically, there are other problems for children of teenage moms, including lower school achievement, more health problems due to health access disparities, adolescent incarceration, becoming teenage parents themselves, and unemployment. There are many different options for birth control, and as you can see in the image, they all have different levels of effectiveness. In the top column, for those that work really well, includes the implant, IUDs, and sterilization. The middle column, which is considered okay, is the pill, the patch, the ring, or the shot. And those in the bottom column are those that don't work as well, and those include Withdrawal, Diaphragm, Fertility awareness, and condoms for both men and women. Abstinence is the only one that is 100% effective. Abstinence is not having sex of any kind. It doesn't cost you anything, and it protects both against sexually transmitted diseases as well as pregnancy, and as I already said, it is 100% effective. Long-acting reversible birth control methods include implants or intrauterine devices, or IUDs. There are 4 different kinds of intrauterine devices. These include Paragard, which is hormone-free, Mirena, Skyla, and Liletta. These 3 all have a small amount of progestin. IUDs are tiny T-shaped plastic devices which are inserted in the uterus and they're placed at the medical provider's office. They create a change in uterine lining to prevent sperm from reaching the egg. IUDs are over 99% effective. Some pros include that they may be left in place for 3 to 12 years, depending on the type. They are private and hidden and can't be felt. They may lighten periods or relieve cramps. Some cons include that they do not protect against STDs, and Paragard may cause cramping or heavier periods. Here is an image of what an IUD looks like after it has been inserted in the uterus. The implant, called Nexplanon, is a tiny plastic rod that is inserted in the upper arm and it is placed at the medical provider's office. It releases hormones to prevent pregnancy. The implant is over 99% effective. Some pros include that it may be left in place for up to 3 years, and it is private and mostly hidden, although it may be felt underneath the skin. Some cons include that it does not protect against sexually transmitted diseases, and it may cause irregular bleeding, heavy periods, or no periods at all. Here is an image of where an implant has been inserted underneath the skin in the arm. Hormonal birth control methods include the pill, the patch, the shot, and the ring. There are multiple brands of the birth control pill, and this is the most common birth control method. You take one pill every day at the same time. You can obtain a prescription from your medical provider and pick up your prescription from the pharmacy. The pill releases hormones to prevent pregnancy, and they are about 91% effective. Pros include that your periods may be more regular, cramps may be less painful, and it can improve PMS. Some cons include that they do not protect against sexually transmitted diseases, and some may have more irregular bleeding. If you skip a pill or on certain medications, you should use other protection. Here are some examples of different birth control pills. The birth control shot, called Depo-Provera, is given every 12 weeks by a medical provider. It prevents ovaries from releasing an egg and is about 94% effective. Some pros of the shot include that you only receive 4 shots per year, it is private and hidden, and may lighten or stop periods over time. Some cons include that it does not protect against sexually transmitted diseases, and you may have irregular bleeding initially. Here is an example of the Depo-Provera shot. The birth control patch is called Xulane, and it is applied once per week. Make sure to take off your previous patch before applying a new one. You obtain the prescription from your medical provider. The Xulane patch releases 2 hormones to prevent pregnancy, and it is about 91% effective. Some pros include that your periods may be more regular and less painful, and you only have to deal with it once a week. Cons include that it does not protect against STDs, and it may cause spotting initially. Here are some examples of where the contraceptive patch may be worn on your body. The birth control ring, called NuvaRing, is a thin plastic ring that is inserted in the vagina monthly. You should remove your old one before inserting a new one, and you can obtain a prescription from your medical provider. Hormones are released to prevent ovulation, and the ring is about 91% effective. Some pros include that they are easy to use, and your periods may be more regular and less painful. Some cons include that it does not protect against sexually transmitted diseases, and it may cause spotting initially. Here is an example of what the ring looks like and how it is to be inserted into the vagina. Barrier birth control methods include the male condom, the female condom, the sponge, the cervical cap, diaphragm, and spermicide. There are multiple brands, textures, and sizes of male condoms. It is a thin covering that is worn over the penis. They can be purchased over the counter or obtained for free from a clinic. You should change your condom with each new sex act. It prevents semen from entering the vagina, and it is about 85% effective. Some pros include that it prevents both pregnancy and sexually transmitted diseases, and they are easy to get and easy to use. A con includes that it can break and/or slip off. It should be put on properly by enrolling it the correct way and leaving room for semen collection at the end. You should be sure to wear the proper size and use the proper water-based lubricant, nothing oil-based, as this weakens the condom. Be sure to remove the condom immediately after ejaculating, after the penis is withdrawn, and prevent spillage. Here is an example of how the male condom is to be placed on the penis. Female condoms are strong, thin, tube-shaped pouches inserted into the vagina. They may be purchased over the counter or obtained for free from a clinic. They prevent the sperm from reaching the egg and are about 79% effective. Some pros include that they prevent both pregnancy and sexually transmitted diseases. They are easy to get and easy to use, and they can be inserted up to 8 hours before sex. Some cons include that they may cause irritation and they may slip inside the vagina. Be sure to not use them the same time as male condoms, as the friction may cause both to break. Here is an example of how the female condom is to be inserted into the vagina. The diaphragm is a soft silicone cup covering the cervix, which is fitted by a medical provider. You should always use it with spermicide. The diaphragm prevents sperm from reaching the egg and is about 88% effective. Some pros include that it can be placed up to 6 hours before sex and may remain in place for up to 24 hours. It is inexpensive and reusable for years, although you should never share it with anyone. It is also easy to hide. Some cons include that it does not protect against sexually transmitted diseases, it may be difficult and messy, it does increase the risk of bladder infections, and it must be left in place for 6 to 8 hours after sex. Here is an image depicting how the diaphragm is to be placed inside the vagina. The cervical cap, called fem cap, is a small, soft silicone cup covering the cervix, which is fitted by a medical provider. It should be used with spermicide. It prevents sperm from reaching the egg and is up to 86% effective. Some pros include that it can be placed up to 6 hours before sex and may remain in place for up to 48 hours. It is inexpensive and can be reused for years, although you should never share it with anyone. It is also easy to hide. Some cons include that it does not protect against sexually transmitted diseases, it may be difficult and messy, it can increase your risk of bladder infections, and it must be left in place for 6 to 8 hours after sex. Here is an example of how the cervical cap is to be worn inside the vagina. Spermicides come in the form of creams, foams, films, suppositories, and sponges. They are to be inserted in the vagina before sex and may be purchased over the counter. It contains chemicals that kill sperm. It is about 71% effective and should be used with other forms of birth control. Some pros include that it is easy to hide and easy to obtain and can be inserted for up to 1 hour before sex. Some cons include that it does not protect against sexually transmitted diseases and can cause irritation. Here are some examples of different spermicides and how it is to be inserted inside the vagina. A birth control sponge is a small piece of foam with spermicide that is inserted in the vagina. It can be purchased over the counter. It contains chemicals that kill sperm, and it also blocks the cervix to prevent sperm from reaching the egg. It is only about 76% effective. Some pros include that it is easy to get and easy to hide, and can be used multiple times in a 24-hour period. Some cons include that it does not protect against sexually transmitted diseases, and it must be left in place for 6 hours after sex. Here is an example of how the sponge is to be worn inside the vagina. Some other birth control methods include the calendar method, coitus interruptus, sterilization, and emergency contraception. Fertility awareness, or natural family planning, means knowing your fertile time of the month and abstaining during this time. This can be very difficult for teens as their cycles are often very irregular. It is only about 76% effective. Some pros include that it is free, there are no hormonal side effects, and it is permitted by many religions and cultures. Some cons include that it does not protect against sexually transmitted diseases, it may be difficult to calculate your menstrual cycle, and it only works if your cycle is regular. Here is an example of someone charting their ovulation cycle. The withdrawal method, or coitus interruptus, means pulling the penis out of the vagina before ejaculation. It is only about 78% effective, and it works best when used with other birth control methods. Some pros include that it is free and there are no hormonal side effects. Cons include that it does not protect against sexually transmitted diseases, and it may be difficult to pull out in time. With the withdrawal method, it's often crossing your fingers and hoping you do not become pregnant. Tubal ligation is a surgical procedure performed on women to stop the egg and sperm from meeting. It is not performed on those under 18 years of age by most doctors in the United States, as this is a permanent method of birth control. It is very expensive to reverse, and that may not work. Some pros include that it is hormone-free and about 99% effective. Cons include that it does not protect against sexually transmitted diseases and it is permanent. Here are some methods of tubal ligation. The fallopian tubes may be banded, they may be cut and cauterized, or they may be cut and tied. A vasectomy is a surgical procedure performed on men to block the tubes that join the sperm with the seminal fluid. It is not performed on those under 18 years of age by most doctors in the United States, as it is a permanent method of birth control. It is very expensive to reverse and may not work. Pro is that it is about 99% effective, and cons include that it does not protect against sexually transmitted diseases and it is permanent. Here are examples of how a vasectomy is performed. They cut the ends of the vas deferens, and they may be tied, closed with a clip, or sealed by heat or cauterized. Emergency contraceptive methods include Paragard Intrauterine Device, Plan B one-step, which is available over the counter, Next Choice one-dose and Take Action, which are both available over the counter for those 17 years of age and older, and Ella, which is only available by prescription. Emergency contraception should be taken as soon as possible after unprotected intercourse to prevent pregnancy, and it can potentially be taken up to 5 days after. It is about 89% effective. The pro is that it can provide protection after sex. Cons include that it does not protect against sexually transmitted diseases, it may be difficult to get depending on age, accessibility, and finances, and it may be expensive. Here is a chart showing the effectiveness of different emergency contraceptions. Be sure to know, depending on which type that you choose, how much time you have to use it, how effective it will be, and how easy it will be to get. So what can be done to prevent teenage pregnancy? As a community, we should provide youth-friendly access to contraception and reproductive services. Adults, such as doctors, nurses, and parents, should provide support and open communication. We should have early sexual and birth control education and teach about the different methods and whether they protect against pregnancy and sexually transmitted diseases, as well as the effectiveness. And what can teens do to prevent teenage pregnancy? They can abstain from sexual activity, they can resist peer pressure, and be prepared, and seek care for proper contraception and use it consistently. Be sure to choose something affordable, and you may be able to get it free or inexpensive at special clinics. Choose something that is easy to use and that will not interfere with a health condition or medication. Remember that it is both partners' responsibility to choose birth control. Regardless of the method chosen, you should still use condoms to prevent sexually transmitted diseases. You can always talk to a trusted adult and obtain sex information from reliable sources, such as your medical provider, medical journals, or medical sites such as the CDC, State Health Department, or Mayo Clinic. This concludes the presentation. If you have any questions or concerns, please talk to your doctor, local health department, or local reproductive clinic. Thank you.